Welcome to today's webcast from the Agency for Healthcare Research and Quality on the SOPS Medical Office Survey, What You Need to Know. My name is Joanne Sora, and I'll be serving as your moderator. Next slide. We have a few housekeeping items at first. If you're having any issues with your computer audio, you can connect to the webcast audio using your phone by clicking on phone call to find the dial-in number and meeting ID, or call me to enter your phone number and receive a call from Zoom. If your computer freezes during the presentations, you can try logging out and logging back in. And at any point in today's webcast, you may ask a question through the Q&A icon. We encourage you to share your name and organization or role when you type your question. Speakers will respond to your questions during the Q&A segment at the end of today's webcast. Please note that both the raise hand and chat features are disabled. You can download the presentation slides and view the agenda and speaker bios on our event website at https://events.westat.com/SOPS. In addition, a replay of today's webcast will be made available on the AHRQ SOPS website in just a couple of weeks. I want to remind everyone that there is only one Zoom link for the entirety of today's webcast. If you leave at any time, you can rejoin using the link provided in the email you received after you registered. Next. Now I'm happy to introduce our speakers for today's webcast. We're pleased to welcome Karen Ginsberg, who directs AHRQ's Consumer Assessment of Healthcare Providers and Systems, or CAPS program, as well as the Surveys on Patient Safety Culture, or SOPS program. I'm also pleased to introduce my colleagues, Ryan Hare, a Westat Research Associate who manages the SOPS databases, and Eileen Tapia, a Westat Research Analyst who supports technical assistance for the SOPS databases. I'm Joanne Sora, a Westat Vice President and Project Director for the SOPS Support Contract, and I'll be moderating today's webcast. Next. On today's webcast, we'll start with Karen Ginsberg providing an overview of AHRQ's patient safety priorities and programs. Then we'll hear from Ryan Hare and Eileen Tapia, who will discuss the SOPS Medical Office survey, database, and various resources that are available to users. At the end of our webcast, we look forward to answering some of your questions during our Q&A segment. So let's begin, and I'll hand it off to Karen. Karen?
Hello, everybody. Welcome. Next slide, please. Welcome, everybody, to this webcast on the Medical Office Surveys on Patient Safety Culture survey, and we're happy you can join us. On the next slide, please. I just want to start off I want to start off today's presentation by telling you a little bit about my agency, the Agency for Healthcare Research and Quality, that supports this effort, and how the SOPS surveys fit into our overall mission and vision. So AHRQ's a research and science-based agency of the U.S. Department of Health and Human Services, and that our agency supports evidence-based practices in the work that we do, and we are the lead federal agency that's charged with improving the safety and quality of America's healthcare system. We are not a regulatory agency. We cannot require the use of any of our tools and products that we're going to be discussing today. Your participation and use of our tools and participation in the database is entirely voluntary, and it's to help you improve the quality of your or the healthcare quality of your organizations, the patient safety culture of your organizations. So if you have requirements to use our surveys for a program participation, it comes from another agency or organization. On the next slide, please. So what we do, we speak about our core competencies at AHRQ. And so what we do is invest in health system research and evidence to make healthcare safer and improve quality. We create tools for healthcare professionals to use to improve care for their patients. And we generate measures and data that help us track the progress of the U.S. healthcare system when we're in improved performance. And all of this is in support of our mission, which is to improve the life of patients by helping healthcare systems and professionals deliver care that's of high quality, high value, and care that's safe. We also feel it's important to push our products, our science to implementation, and get our tools and products out to you, our users. On the next slide, please. I just want to review what our patient safety priorities are. At AHRQ, our priorities are to focus on the areas of greatest impact, extend patient safety improvement to all settings, prevent healthcare-associated infections and reduce antibiotic resistance, build capacity in the healthcare system to accelerate safety improvements, improve communication and engagement between clinicians and patients, and generally just make the safe thing the easy thing to do. On the next slide, please. AHRQ has continuously funded the SOPS program since 2001, and this is a program to advance the understanding, the measurement, and improvement of patient safety culture in healthcare settings. We do a number of different things. We develop validated surveys and measures. We support voluntary data submission to our databases. We conduct research to further the measurement and understanding of patient safety culture. And as I mentioned, we develop tools to improve patient safety culture in facilities. And I just want to point out that the SOPS surveys are trademarked. And what that means is that this trademark ensures that the surveys are valid and reliable and have met certain criteria in their development and testing. On the next slide, please. I just want to review our definition of patient safety culture. We say that patient safety culture can be defined as the beliefs and the values and the norms that are shared by healthcare providers and staff in an organization. And we say that patient safety culture determines the behaviors that are rewarded, supported, expected, and accepted within an organization as they relate to patient safety. We want to note that patient safety culture can exist on different levels in the organization, from the unit to the department to the organization itself, and then up to the healthcare system level. The next slide. So the SOPS surveys are surveys of providers and staff about the extent to which their organizational culture supports patient safety. So you can see the SOPS surveys that we've developed. The first one released was the hospital survey in 2004 and updated in 2019. Since then, we've developed the nursing home survey, the medical office survey, which we're going to talk about today, community pharmacy, and ambulatory surgery center survey. We refer to these surveys as our core surveys, and we're going to talk today about also about supplemental item sets that you can use to customize surveys. And all of our surveys and item sets undergo the same development process and the same testing process to assure that the topics are meaningful to you, our users, and to ensure the reliability and the validity of our survey instruments. So on the next slide, please. I just mentioned optional supplemental item sets, and these are optional items that you can use to customize your survey. You would use the core survey and add this optional supplemental item sets. We have instructions on the cover page of the survey that tells you how to add them, and then you can have a customized SOPS survey with a survey and an optional supplemental item set. And so on the next slide, you can see the supplemental item sets that we've developed. For the hospital survey, we have supplemental items on health information technology, workplace safety, value and efficiency. We also have a value and efficiency item set for medical offices, as well as one on diagnostic safety. And we have a workplace safety item set for the nursing home survey. On the next slide, I just want to review for you how SOPS surveys are used. SOPS surveys can be used to raise awareness among your staff about patient safety culture. They can be used to assess patient safety culture, to identify strengths and areas for improvement. They can be used to examine trends over time, and they can be used to evaluate the impact of patient safety initiatives before and after measurement, for example. So thank you so much again for attending. I'm going to turn this over to Ryan.
Hi, thanks, Karen, and good afternoon. Hello, everyone. My name is Ryan Hare, and I'll be speaking about the SOPS Medical Office survey today. Next slide, please. So the SOPS Medical Office Survey is designed specifically for outpatient medical office providers and other staff, and asks for their opinions about the culture of patient safety and healthcare quality in their medical office. It's appropriate for any specialty, whether that is primary care only, other specialty care services only, or a mix of both primary and specialty care services. For the purposes of this survey, a medical office is considered a single outpatient facility in one geographic location. A medical practice or healthcare system may have multiple medical offices in different locations, but each location is considered a separate medical office. In addition, if there are multiple medical offices in the same building, each office is considered as its own separate office. Now, if providers in a medical office share some or all administrative staff, such as receptionists and schedulers, and also share some or all clinical support staff, then you may consider this as one office. Next slide, please. We recommend administering the survey in medical offices with at least 5 providers and staff. The survey is designed to be administered to all providers and staff in your medical office as appropriate. This includes billing staff, receptionists, nurses, and physicians. Staff members can be clinical, non-clinical, part-time, full-time, per diem employees, or even contract employees. To ensure staff are able to accurately respond to the survey questions, staff should have enough knowledge about your medical office and its operations to provide informed answers to the survey questions. Now, for staff who work at more than one medical office, the survey should be distributed at the medical office where they spend most of their time, and staff should answer only about that medical office. If staff spend equal time at multiple medical offices, you should choose one office for them to receive the survey and have them answer the survey only for that medical office. Next slide, please. So these here are the 10 areas of patient safety culture, also known as composite measures, that are assessed by the SOPS Medical Office survey. A composite measure is a group of 2 or more survey items that assess the same area of culture. The 10 composite measures in the medical office survey are each made up of 3 to 4 items for a total of 38 items, and are intended to measure communication about error, communication openness, office processes and standardization, organizational learning, overall perceptions of patient safety and quality, owner/managing partner/leadership support for patient safety, patient care tracking/follow-up, staff training, teamwork, and work pressure and pace. Now, these are areas that are deemed important for patient safety and to promote a culture of patient safety. These survey composite measures were reviewed by experts and pilot tested as part of our rigorous survey development process. Next slide, please. The survey also includes a single item to assess near-miss documentation and an overall rating on patient safety. In addition, there are 3 items to assess communication in the procedure/surgery room. Other items include a series of questions about patient safety and quality, information exchange with other settings, a screener question related to items that ask about leadership support, several items related to overall ratings on quality and patient safety, and 3 background questions that ask about the respondent's tenure at the medical office, their typical hours worked per week, and their staff position. And the survey also includes a space for respondents to provide their comments. Next slide, please. There are optional supplemental item sets that users may add to assess content areas that are not included in the core medical office questionnaire. The SOPS Diagnostic Safety Supplemental Item Set for medical offices is designed to be used in conjunction with the core SOPS Medical Office Survey to help medical offices assess the extent to which their organization's culture supports the diagnostic process, accurate diagnoses, and communication around diagnosis. 3 composite measures consisting of 12 items address the topics of time availability, testing and referrals, and provider and staff communication around diagnosis. Now, if you use these supplemental item sets, they should be added near the end of the core survey, just before the background questions. Next slide, please. Additionally, the SOPS Value and Efficiency Supplemental Item Set for medical offices is designed to be used in conjunction with the core medical office survey to help medical offices assess the extent to which their organizations prioritize and adopt practices to promote efficiency, waste reduction, patient-centeredness, and high quality of care at a reasonable cost. There are 4 composite measures consisting of 13 items, which address empowerment to improve efficiency, efficiency and waste reduction, patient-centeredness and efficiency, and owner, managing partner, and leadership support for improving efficiency and waste reduction. An additional 8 items in the supplemental item set assess experience with activities to improve efficiency. And if used, again, these supplemental items should be added near the end of the core medical office survey, just before the background questions. And with that, I will hand things over to Eileen to share some information about the SOPS Medical Office database.
Thank you, Ryan. My name is Eileen Tapia, and I'll be speaking about the SOPS Medical Office Survey database. Next slide. AHRQ supports databases for each of the 5 core SOPS surveys. Today, we'll be speaking about the SOPS Medical Office database. Next slide. The SOPS Medical Office database is a central repository for survey data from the SOPS Medical Office survey. It's the largest public central repository of patient safety culture data for medical offices that we're aware of. The medical office survey is for facilities. Although individual providers and staff take the survey data are submitted at the facility level for all respondents. Healthcare organizations that administer the SOPS Medical Office survey can voluntarily submit their data to the database during the data submission period. The database allows medical offices to compare their facility survey results to the aggregated average results of other participating medical offices. All data that's reported is de-identified. Next slide. So why should your facility participate in the SOPS Medical Office database? First, facilities that submit to the database are part of the results produced in a database report with de-identified facility level statistics. Here's an example of the 2022 SOPS Medical Office database report, executive summary infographic that you can download from the AHRQ SOPS website. The full 2022 Medical Office database report is also available for download on the AHRQ website. Next slide, please. One of the greatest benefits of submitting to the SOPS database is receiving a customized feedback report. Each participating organization receives their own individual feedback report for each facility they submit data for. The report provides a summary of your results, which includes survey administration statistics, composite measure and item % positive scores, breakout results by various respondent characteristics, as well as a comparison of your survey results with overall database averages. If an organization submits survey data from more than one medical office within their health system, they'll also receive a system-level feedback report in addition to the individual site reports. The feedback reports are produced as a PDF and can easily be shared within the participating organization. We recommend that you share your results with folks at every level of the organization, from leadership to department managers and frontline staff. That way, everyone at all levels understands their areas of strength and where there's opportunities for improvement within the organization. Next slide. So, which medical offices are eligible to submit? Eligible medical offices are outpatient facilities in a specific location. If there are multiple medical offices in the same building, each office is considered its own separate office. They must administer the SOPS Medical Office survey in its entirety without modifications or deletions of the core survey item text, and/or response options. Changes can only be made to the background questions at the end of the survey. You can't reorder or insert new items or supplemental items within the course survey. Supplemental items should only be added to the end of the course survey before the background questions. Next slide. You might ask, what do I have to do to be part of the SOPS Medical Office database? The submission process involves a few easy steps. Step 1, register for an account on the SOPS Medical Office database. Even if you've submitted to the database in previous years, you'll still need to register for this round of submission. We'll be sending a registration announcement via the SOPS Medical Office listserv on September 1st. You can register anytime during the submission period. Step 2, sign and submit a data use agreement, or DUA. The DUA assures medical offices of the confidentiality of their data and explains how their data will be used. Step 3, enter site information for each medical office you'll be submitting data for. This includes information such as site name, address, specialty type, point of contact information, number of surveys distributed, survey administration dates, etc. Again, for the purposes of this database, each medical office site or location needs to be identified as a separate site. Step 4, submit your questionnaire for our review. We have to review and approve your questionnaire before you're able to submit your survey data. If you'd like for us to review your questionnaire prior to data submission or your survey administration, you can email it to us and we'll review and provide you with feedback. And then the final step is to submit your survey data. Once you submit your data, the system provides an automatic frequency report that will indicate if your survey data was entered correctly or if there are any issues that need to be addressed. Next slide. The previous medical office database submission was in 2021, and the SOPS Medical Office database report was released in January of 2022. The database includes 1,100 participating medical offices with 13,277 respondents. Next slide. 87% of medical offices in the 2022 database were owned by a hospital or health system. 46% of medical offices had 4 to 9 providers per week. In regard to respondents in the 2022 database, 27% of those respondents were other clinical staff or clinical support staff, which was the most prevalent staff position. And 64% of respondents worked 33 to 40 hours per week in their medical office. Next slide. The 2022 SOPS Medical Office Database Report presents average % positive composite measure and item results. As you can see here, the highest scoring composite measures were the patient care tracking / follow-up and teamwork composite measures at 85% positive. The patient care tracking / follow-up composite measure assesses respondent perceptions about how often their medical office reminds patients about appointments, documents how well patients follow treatment plans, and follows up with patients and outside providers. The teamwork composite measure assesses respondent perceptions about the extent to which their medical office has a culture of teamwork, mutual respect, and close working relationships among staff and providers. Next slide. The lowest scoring composite measures in the 2022 database was work pressure and pace at 43% positive. This composite measure assesses respondent perceptions about whether there are enough providers and staff to handle the patient load and whether or not the office work pace is hectic. Next slide. On average, 65% of respondents gave their medical office an overall rating on patient safety of excellent or very good. Next slide. In terms of overall rating on healthcare quality, equitable was the highest rated area. On average, 83% of respondents reported that their medical office is excellent or very good at providing the same quality of care to all individuals, regardless of gender, race, ethnicity, socioeconomic status, language, etc. The lowest rated area of healthcare quality was timely. On average, 57% of respondents reported that their medical office is excellent or very good at minimizing waits and potentially harmful delays. Next slide. So when can you submit to the next SOPS Medical Office database? Database submission will be open in just a couple of months from September 1st through September 22nd of 2023. Medical offices may submit their most recent survey data from surveys administered between November 2021 and September 2023. To be clear, if you administered the survey more than once during November 2021 and September 2023, we only want data from your most recent survey administration. In addition to the core medical office survey data, we'll also accept data from the SOPS supplemental item sets that were administered with the medical office survey. This includes data from the diagnostic safety and value and efficiency supplemental item sets. Next slide. For those looking ahead to 2024, I'm happy to let you know that the SOPS Hospital Survey Database will be open for submission from June 3rd through the 21st of 2024. If your medical office is part of a health system, we encourage you to administer and submit data from the hospital or hospitals in your system. Information about the second database and submission dates will be forthcoming. I'll now hand it back to Ryan to talk about the numerous resources we have available for the SOPS Medical Office Survey.
All right, thank you, Eileen. We're definitely looking forward to those upcoming data submission periods and also seeing the results from those databases. So I'm back once again to speak about the SOPS Medical Office resources. Next slide, please. We offer many important and helpful resources to survey users. The Medical Office Survey Users Guide is a very useful starting point as you begin your SOPS survey journey. The Survey Users Guide can be found on the AHRQ website and provides detailed information and guidance about how to administer the SOPS Medical Office survey. This includes information from getting started with your survey all the way to analyzing your data and reporting your results. Next slide, please. After you've administered the SOPS Medical Office survey, you can then use our data entry and analysis tool to create tables and graphs of your survey results. The tools use Microsoft Excel to assist with entering survey responses and automatically generate your results. You can also export your survey data into a separate Excel file for submission to the SOPS Medical Office database. And this is really helpful to ensure your data is formatted correctly for submission. These tools are very easy to use. Users key in their survey responses or copy and paste the responses from their web survey output into the data entry sheet, and then you see your results. To use the tool, users must have Excel macros enabled on their computer. In addition to the medical office Excel tool, we also offer an Excel tool for each of the survey settings and supplemental item sets. We update them after each database submission to include the latest survey benchmarks. And these Excel tools are not available for download on the AHRQ website. However, you can request a copy by contacting our database technical assistance help desk, which I'll provide contact information for towards the end of this presentation. Next slide, please. This here is an example of one of the graphs that are automatically generated in the Excel tool. So after you input your survey responses, the tool automatically generates these results. And for each survey item within the patient care tracking follow-up composite measure, the Excel tool calculates the % positive, neutral, and negative, and displays them in a 3-part bar chart, as you see here in this example. The tool also provides the percentage of respondents who did not answer the question or selected the does not apply or don't know response option. Next slide, please. After you've administered the survey and analyzed your responses, you can then use our action planning tool to assist you in developing an action plan based on your results. The action planning tool is available on the AHRQ website and is designed for all SOPS survey settings. It provides step-by-step guidance to help survey users develop an action plan to improve patient safety culture within their organization. This tool includes an action plan template that your organization can use to identify your patient safety culture areas for improvement, document your goals and initiatives and needed resources, processes and outcome measures, and your timelines. Next slide, please. We also offer improvement resources that you can use to positively increase your survey scores. As you're working on your action plans and identifying areas for improvement, you might also find our Improving Patient Safety resource list useful to you. This document is available on the AHRQ website and contains links to practical resources that are free and publicly available to help you improve patient safety culture and patient safety in your medical office. Next slide, please. Additionally, we offer improvement resources focused on the improvement of SOPS Medical Office supplemental item set results. There's one for the Diagnostic Safety supplemental item set and another one for the Value and Efficiency supplemental item set. These documents too are also available on the AHRQ website. Next slide, please. We offer free technical assistance, also known as TA, to SOPS survey users. Our general TA help desk can be reached by telephone at 1-888-324-9749 or via email at safetyculturesurveys@westat.com. Now, the general TA help desk can help you with questions about survey administration and connect you with any of the survey materials and supporting resources. International survey users can also contact the general TA line to request permission to use any of the SOPS surveys in their respective countries. Our database technical assistance help desk can be reached by telephone at 1-888-324-9790 or via email at databases-on-safety-culture@westat.com. Our database TA can assist with all aspects of submitting to the SOPS databases, from the first step of just registering for the submission, all the way to the final steps of formatting your data files and getting that submitted. They can also send you the SOPS data entry and analysis tools and answer any questions about the database reports and the benchmarks. We're very happy to help you in any way that we can, so please don't hesitate to contact us. Next slide, please. So with that, I'll now turn it over to Joanne to facilitate our question and answer segment. Joanne?
Great. Thanks so much, Ryan, Karen, and Eileen for your presentations. I think we provided a lot of helpful information about the medical office survey and database. As a reminder to our attendees, you may ask a question through the Q&A feature shown here. Look for the next slide. Look for the Q&A icon, and we encourage you to share your name and organization or role when you type your question. So if you joined late or want to watch today's webcast replay, we will post a replay on the AHRQ SOPS website in a few weeks. So I'm going to turn now to some questions that have come in through the chat, through the Q&A feature. And then there were also a few questions that we received during registration. So Karen, Ryan, and Eileen, if you're ready. This first question is from Sonia Cass, and I think it's for Ryan. Are there any recommendations on how long an employee should be employed before completing a SOPS survey?
Okay, thank you, Sonia. Great question. I'd say overall, when considering who should complete the survey, you should ask yourself, does this person know about the day-to-day activities at this medical office? This can take varying amounts of time depending on your organization. So, whether they've been there a couple months or longer, it's really just important that they know the day-to-day activities of your medical office.
Okay. The next question's from Sonia Cass as well, and this is for Karen. As a federally qualified health center, we also offer behavioral health and dental services. Are there plans to develop, SOPS surveys for those specific areas?
So thanks for that question, Sonia. That's a good question. The SOPS surveys are specific to organizations and facilities. And if the behavioral health and dental services are within your facility, they can use the general, that they can use the medical office survey. You could look at the results for just the behavioral health or dental health services unit separately from the rest of the survey. Typically, we don't develop SOPS surveys for specific conditions. But I'd like to know the kinds of things that you're interested in finding out, what maybe the patient safety culture issues might be in your in behavioral health and dental services. So if you wouldn't mind just writing us at the TA line to the TA mailbox to tell us some of the things that you're thinking about, we'd really like to see what your concerns are, and we can get back to you more specifically with an answer.
Okay, great. Next question was actually asked by two people, so we're sort of consolidating. For step 1 in the data submission steps, which was register for an account, can we register, or can a medical office register before September, for example, now in July, and then later submit the data in September? So Eileen, I wonder if you can answer that question.
A great question. Unfortunately, you can't register before September. The medical office database opens on September 1st, but if you'd like to get a head start and send us your GUA or questionnaire for review, you can certainly do so by emailing it to us at databasesonsafetyculture@westat.com.
Great. Next question, does the survey or participating in the database cost, is there any cost to facilities for conducting or administering the survey or participating in the SOPS databases? And I guess this would be for Ryan.
So the survey and all the related like toolkit materials and resources are free and publicly available on the AHRQ website. You can just visit the AHRQ website to download them. Participation in the database submission is also free. The reports that we produce of your results are also free, and so is the technical assistance that we provide. So overall, free.
Okay, great. Next question is also for you, Ryan. How do we appropriately group our small clinics so that the survey return quantity is large enough to yield reportable results?
Thank you for the question. So when you submit to the SOPS Medical Office database, the minimum number of respondents required to receive a feedback report of your results is 5. However, medical offices that are part of like the same health system will also receive a system level feedback report with aggregated results from the entire health system.
Okay, and sort of a follow-up question to that. When we say 5 providers or 5 respondents are required, what if you have at least 5 people in the medical office, but not all of them complete the survey? What happens then?
So I just also first want to clarify that it's not just providers, it's providers and staff. And so you want to have at least 5 providers and staff. And if not all of them respond, that's okay. You would just need at least 3 responses to be able to submit to the database.
Okay, thank you. This is a question for Ann Millman. Is it possible to see how certain types of medical offices compare to other medical offices of that type? Or is the comparison only to all medical offices? So can you compare the results by the type of practice, for example? This is for maybe for Ryan.
Yes, so the medical office database report does provide breakouts by different medical office characteristics. I think region and number of providers per week, I believe is what it is. So,
Okay, so check the SOPS Medical Office Database Report appendix, which has lots of different breakouts by the staff areas and by types of medical offices, et cetera. Specialty, I think, is probably in there. Okay, let's see. This is for Eileen. Do you have a list of vendors who administer the SOPS surveys?
A great question. So there are many vendors that can be hired to conduct your survey data collection by either paper, web, or both. However, AHRQ doesn't recommend any specific vendors. We can only provide you with the list of vendors that have submitted to the SOPS databases, but we don't have information about the quality of the service provided. So we're not endorsing them. You'll want to conduct your own research to determine whether you want to hire any of these vendors, but you can reach out to the SOPS TA team at databasesonsafetyculture@westat.com to get that list of vendors.
Okay, thank you. Question for Ryan. What are the benefits to implementing the SOPS survey in our practice?
That's a really important question to ask. So the SOPS surveys assess providers and staff perceptions of patient safety culture in your organizations. The surveys themselves are reliable, comprehensively tested, so you can be confident that you're using a valid instrument tool. And as the saying goes, what gets measured gets managed. So you can use these surveys and the data that comes from them as a way to identify strengths and opportunities for improvement and compare your survey results to other organizations.
Okay, great. Next question is for Karen from Natalie Harper. There is great value in this survey either way, but just to verify, Florida has a new state requirement for completing the inpatient and ambulatory surgery center safety culture surveys for public reporting purposes. To your knowledge, are there any other areas that require the medical office survey?
Thanks for that question. And we're absolutely aware of this Florida requirement that that inpatient facilities and ASCs submit the SOPS survey to the state. I don't know of any area or any place that requires the medical office survey, but I just wanted to say that we are not connected to that Florida requirement. They do not submit to our database as a way of fulfilling that requirement, although they can if they want, but for the purposes that we provide. I want to assure everybody that when you submit to our database, this is for your own quality improvement purposes. Your information, your identifying information does not go anywhere other than to our database. There are strong firewalls and data protections in place to prevent sharing this information. I don't know, AHRQ does not know who submits to the database. So it's kept confidential, and our program, our voluntary data submission programs, are not connected to any state requirement. They are absolutely independent of requirements.
Okay, thank you, Karen. Next question is from Ann Millman, and I can actually answer this. Do you have recommendations on when a provider should complete the medical office survey or the hospital survey? For example, an obstetrician who sees patients in clinic as well as has deliveries in the hospital. When administering the SOPS surveys, typically it's the organization or the health system that will initiate the survey administration. So if your health system is administering the medical office SOPS, then the obstetrician would get the medical office SOPS survey through their affiliation with their clinic. And typically these surveys are administered at different times of the year. We have different data submission timeframes. On the other hand, the same obstetrician might also get an invitation to complete the hospital survey if the hospital they work in is administering the hospital version of the survey. But either way, the obstetrician would answer the appropriate survey about the context that they're being asked about. So if they get the hospital survey, they'll answer about their experience working in the hospital with deliveries. And if they get the medical office survey, they'll be answering about their experience with the culture in their medical office or their clinic. Next question from Ann Millman. When will the medical office SOPS database be open for submission again? We won't be surveying until the end of September this year, so we won't be able to submit in that September timeframe. So Ryan, can you answer this?
Absolutely. Hi, Ann. So generally data submission opens every 2 years. So kind of like every other year cycle, but the exact timing for the next medical office SOPS database has not yet been decided. But of course, keep an eye out on your emails, notifications and whatnot over the next year or so to make sure you're notified about all of our database submissions upcoming.
All right. Next question is for Eileen. If a data file that's submitted to the database is rejected during data submission because it has some minor errors, can the medical office resubmit within the time period in order to get that data file corrected?
That's a great question. Yes. So this is all part of the submission process, and we'll work with you to correct any issues that you may have.
Okay, great. Next question is also for you, Eileen. Can international facilities submit to the SOPS databases?
Another great question. Unfortunately, no, the SOPS databases are only open to US facilities. So unfortunately, international facilities are ineligible to submit their data.
All right. Next question is for Ryan. It's a little bit of probably an extended answer. So how should we interpret our results, communicate our results throughout the organization, or recommend suggestions for improvement?
So the action planning tool, which I talked about earlier, it really helps to develop an action plan for your healthcare organization. You can start with how to interpret your results and identify which areas to focus improvement efforts. From there, the SOPS resource lists are available for all survey settings, including medical office. And that contains references to websites that provide practical resources to improve patient safety culture and patient safety. But note that that list is not exhaustive, but it's meant to offer an initial guidance for those looking for information about patient safety initiatives.
Okay, thank you. Next question is for you, Ryan. For a medical office that's administering a paper survey, do you have any tips or tricks for converting the paper survey to answers that, so that they can impute the data or make the data electronic, and maybe you can speak to how the Excel tool might be able to assist in that as well.
Yeah, sure. So I recommend creating a coding or annotated survey that lets the data entry specialist know the variable or column and values to input. So using this survey from the AHRQ website, for instance, you can see that for the first question, A1, we use a numbers for each response option, where 1 equals strongly agree, and 1 equals strongly disagree, 5 equals strongly agree, and 9 equals doesn't know. So you want to use that sort of coding system. But also, if you input your data into the medical office data entry and analysis tool, you can then export that data to another Excel file, which you can then submit to the database, and it'll already be formatted with the correct variable names and whatnot that is needed for submission.
Okay, really helpful. At this time, I don't see any additional questions. So just final call for any questions that we see. Okay, I do see another question here. This is a question for you, Ryan, from Celia Goodson. Is there a recommendation regarding administering survey questions via paper or online?
So you can do both, either paper or web. I recommend taking a look at the Medical Office Survey Users Guide. It's a great resource and it helps you walk through what may work best for your organization. That Survey Users Guide can be found on the AHRQ websites underneath the Medical Office Survey page. So check that out, and it's got some good recommendations and guidelines in there.
Okay, great. Well, let's go to the next slide then. So again, we periodically send announcements through SOPS email updates, which may be how you heard about this webcast. Our email updates notify users about various SOPS news and activities, data submission timelines, etc. And so you can sign up to receive these emails by clicking the email updates link at the top right corner of the AHRQ website, and then choosing the email updates associated with the surveys on patient safety culture. And as we said, as Ryan previously mentioned, you can contact the surveys on patient safety culture databases or regular TA if you have any further questions. We can just go to the next slide. So a brief webcast evaluation will pop up when you close out from today's webcast. You have to click continue in your browser to go to the survey. So please take a moment to give us your feedback, as it helps us with future offerings and planning for future events that meet your needs. We invite you to visit the AHRQ website and the SOPS website and contact us at any time. Thanks again for joining us. This concludes today's presentation.